Hi everybody, I'm Dr. Isiorho from Corrective Step Foot Health Center in Tigard, Oregon. I have a patient today who's about to undergo a percutaneous flexor tenotomy. So that's a big $5 word. What that basically means is she's going to get her tendon cut through her skin through a minimally invasive incision. So this is technically a minimally invasive hammertoe procedure. As you can see, she already has the dressing on her toe. She's undergone my blade beforehand. In this case, we're actually trying to prevent more pressure from occurring on that far part of the toe by releasing that tendon. And part of it is we can see that she has a little bit of flexibility. Now, her toe's really swollen today, and we've kind of talked about that beforehand, but you can see that some of her toes are a little bit more flexible and they can straighten out, and that's what we're looking for. We're going to try to get that toe to straighten out a little bit more. So instead of rolling on the tip of her toe, it's going to be on the bottom of her toe. And so our patient's good and numb. Can you feel anything at all, my dear?
No.
Okay. So we get our small incision, which is actually going to be a gauge needle, 18 gauge needle. And we find the plantar sulcus of the patient. And when I say plantar sulcus, we're talking about those lines that go across, and that's where we're actually going to be making our incision. Now our staff has already gotten this patient prepped, and that's why the skin looks a little bit discolored. So we make our percutaneous incision, and we make a sweep. And what you might be hearing is actually a tendon being separated. It sounds like celery stalk. And what you're actually feeling is that toe straightening out as well too. So I'm just sweeping, make sure I have everything to release that tendon. And there's a lot of swelling, that's why you see the fluid coming out. Almost there. All right, putissimo. So now the toe doesn't curl down quite as much. And you can see already just in that small change, that improvement right there. So we'll prep that toe. We usually will dress the toe at this point, but since we're going to be doing more wound care, we're just going to leave it like that. But typically the follow-up instructions are you're going to keep this dressing on for at least 24 hours and then change your dressing once or twice a day per drainage. You want to make sure when you change the dressing, you splint the toe in a straightened position. That way the tendon doesn't want to find itself and contract and curl back down again, because that's not exactly what we want to do. Typically the incision heals in about 3 to 7 days. Yes, the incision heals within 3 to 7 days. That means you can be taking a shower if you didn't have any other dressings on. So yes, this is a wonderful procedure for some patients, not for all patients. But until next time, take care. Dr. I out.